This is really a revolutionary phase 3 clinical trial in patients with transthyretin cardiac amyloidosis. It's the first large-scale phase 3 gene editing trial ever done in any condition. And so we're really excited pushing the envelope here at Northwestern and across the world of pushing this therapy forward and seeing if it works. We know that transthyretin protein, we all have it, but in patients with wild type or hereditary forms of transthyretin cardiac amyloidosis, the protein is unraveled, it forms amyloid fibrils, deposits in the heart, and because of that, they develop congestive heart failure. Now, the therapy, gene editing, what it does is that it's a one-time single infusion that goes into the body, and then it's targeted to the liver through a special GalNAc moiety, which is a molecule that goes onto the gene editing therapy, and then that is targeted to the hepatocytes in the liver. It's really quite clever because one thing we know is that the gene editing, the CRISPR-Cas9 construct, has to get into the hepatocytes, the liver cells, and get into the nucleus and into the DNA. So that's how it does it. And then it basically just turns off the transthyretin gene. And so no more of this protein, the transthyretin protein, is made, and we can knock down the protein more than 90 to 95% and really hopefully reverse the disease. So this trial is really a randomized 2-to-1, so patients have a 2-to-1 chance to get the actual therapy versus placebo drug trial, and it's an outcomes trial. So we're going to see how many patients have heart failure hospitalizations, what's the survival, and how do they feel and their exercise capacity. I think there's a lot of precedent to think that this will be a positive trial. It'll reduce mortality, it'll improve outcomes, reduce heart failure hospitalizations, improve 6-minute walk distance, reduce symptoms. What I would tell clinicians and healthcare providers that are taking care of these patients, if you need any help at all in diagnosing transthyretin cardiac amyloidosis, please reach out to us. The easiest way is just calling the phone number listed below on the screen. We're happy to help. And secondly, don't worry too much about the inclusion-exclusion criteria. If you have a symptomatic patient with transthyretin amyloid cardiomyopathy and they have signs and symptoms of heart failure, we'd love to talk to you about that patient, see if they're an ideal candidate for the trial.